Good day everyone, I am Ana Saldo together with my groupmates, and now we are going to report about polygraph under pressure analyzing accuracy factors. And the case analysis that we choose is about the overconfident examiner. A polygraph, commonly known as a lie detector test, is a tool used in criminal investigations and under setting to determine whether a person is being truthful. It measures physiological changes such as heart rate, blood pressure, respiration, and skin conductivity. These responses are recorded while subjects answer a series of control and relevant questions. If there are significant physiological vibrations, the examiner may interpret them as signs of deception. However, the accuracy of polygraph result does not solely depend on the machine, but also on the competence of objectivity of the examiner. In some cases, overconfidence in examiner ability to detect deceptions can lead to misinterpretation of psychological responses, resulting into incorrect conclusion. This study focuses on case where an overconfident examiner misreads a suspect's physiological responses and mislabels them as deceptive. By analyzing this issue, we aim to identify the factors and affect polygraph accuracy and propose solutions to improve reliability in polygraph examinations. So the next reporter will be Idol.
Hello sir, I am Jermac Idol. I am next reporter. Topic is case study analysis. Scenario: the overconfident examiner. In this case, a suspect undergoes a polygraph test as a part of an investigation. From the beginning, the examiner appears overly confident in their ability to detect deception, believing that their experience alone makes them highly accurate. The suspect, who is already anxious about the test, displays an increased heart rate, rapid breathing, and sweating. Instead, objectively analyzing the data and considering alternative explanation, the examiner immediately interprets these physiological changes as a sign of dishonesty. The suspect insists they are telling the truth, but the examiner remains convinced of their deception based on their physiological responses. Because of this misinterpretation, the suspect is wrongly accused, leading to serious consequences such as legal troubles and damage to their reputation. This case highlights how an examiner overconfidence and bias can negatively impact polygraph accuracy. The lack of careful evaluation and reliance on intuitions rather than scientific method leads to error, raising concern about the fairness and reliability of polygraph tests. So next.
So I'm Aaron John Pabiliran, the next reporter, and my assigned report is factors affecting accuracy. So, examiner competence. The examiner's overconfidence results in a lack of objectivity and critical analysis. They fail to consider alternative explanation for the suspect physiological responses. Their bias and preconceived notions about the suspect influence their judgment. They neglect proper analysis of baseline responses, leading to incorrect conclusions. Physiological responses. The suspect natural anxiety causes physiological changes, including an increased heart rate, rapid breathing, and sweating. These responses are not necessarily linked to deception but are mistakenly interpreted as dishonesty. People have individual physiological differences. Some may react more strongly to stress than others. Physiological factors. The examiner's overconfidence may create an intimidating atmosphere, increasing the suspect's anxiety. The suspect may experience fear of being falsely accused, leading to heightened physiological reactions. The stress of taking a polygraph test itself can trigger bodily responses similar to deception, making result unreliable. Environmental factors. The testing environment may contribute to stress affecting the suspect physiological responses. The pressure to obtain quick results may cause the examiner to rush through the process, leading the errors. Inconsistent testing conditions can result in variations in result, making them harder to interpret accurately. And
Good day, sir. I'm next reporter, Renal G. Solon. Standardized training for examiners. Examiners should undergo rigorous and standard training to ensure objective and scientific interpretation of polygraph data. Training should focus on avoiding bias, properly analyzing responses, and distinguishing between stress and deception. Examiners should be recessed periodically to prevent overconfidence from compromising their judgment. Double-blind review of polygraph result. A second examiner should review polygraph result independently to minimize bias. This process ensures that a single examiner's overconfidence that does not lead to misinterpretation. Have multiple expert opinions, improve accuracy and reliability. AI-assisted analysis. Artificial intelligence, AI can be used to analyze physiological response more objectively. AI-based system can confirm responses with large dataset to reduce human error and bias. This technology can assist examiners by providing a data-driven interpretation rather than relying on personal institution. Pretest calibration of baseline readings. Examiners should establish a proper baseline by asking neural control questions before the actual test. Comparing responses to both neutral and relevant questions allow for a clear distinction between stress and deception. This approach reduces misinterpretation and increases test accuracy. Strict interpretation protocols. Examiners should follow scientific guidelines and structured protocols rather than relying on personal beliefs. Checklists and standard procedures should be implemented to ensure consistency in interpretation. Regular peer reviews and case studies should be conducted to maintain high professional standard.
My name is Richmond G. Glohano, and in conclusion, this case study demonstrates how an examiner's overconfidence and bias can negatively impact polygraph accuracy. When an examiner misinterprets natural stress response as deception, it can lead to serious consequences, including wrongful accusations and legal injustice. So to improve the accuracy of polygraph examinations, standardized training, double-blind reviews, AI-assisted analysis, pre-test calibration, and strict interpretation protocols must be implemented. by ensuring that examiners remain objective, well-trained. So that's all. Thank you, sir. God bless.